name's Karina Santos, and I'm a nurse practitioner for palliative care, inpatient for Hope Health, and I typically work at Rhode Island Hospital. So my involvement with palliative care has been kind of lifelong. I didn't learn about palliative care until around 2014. And funnily enough, I met one of my colleagues in my work in the ICU, and I kind of fell in love with the values and the concept of whole person, family-centered care. And then I realized that palliative care was really what's been the way I practiced as a nurse pretty much my entire career. The goal that I'm trying to set for what's called culturally competent palliative care is really the center of what's patient and family-centered care, in that we want to respect and provide the most comprehensive type of care for people of all types of walks of life. So everybody that's coming from different cultures, different racial backgrounds, different belief systems, different value systems. I really want clinicians to feel comfortable exploring patients and families' values, and then also feel more comfortable and more better equipped with being able to explore the differences in our cultures. I think it's so important when we're providing medical care that we are very respectful, and that we're also humble in that we don't all practice things differently. We believe different things, especially when it comes to life, death, and dying. I think different cultures value different things at certain points in life, and it's important for clinicians to be able to explore those values respectfully, and at the same time provide the most appropriate medical care that respects those values for patients and families. One of the biggest things, at least from my personal perspective, is particularly with the large Latino and Hispanic population that we have growing in the U.S. and particularly in Rhode Island. One of the biggest things I want clinicians to take away from this course is a better understanding of what the Latino community is about, where we come from, what our values are. And the biggest takeaway that I can think of, at least, is that our values as a Latino and Hispanic community really do align with the values of hospice and palliative care. Unfortunately, there's misunderstandings and misconceptions throughout the community, both in the medical community and in the Hispanic community, but we really do align. I think we just need to get together and understand each other better. And I think in that way we can pretty much kind of at least try to get rid of all these disparities and provide better outcomes. The biggest reason, I think, is, at least particularly for Rhode Island, we have such a large Latino and Hispanic community, and our workforce doesn't always reflect the community that we serve. So at least after this course, I really hope that everybody that participates or attends or listens to it can no longer say that they don't know a Latino provider and that they don't know anybody from Guatemala, because I'm Guatemalan, I'm a practitioner. So everybody that comes to this course can say, I know somebody from Guatemala.